Today's webinar is being presented by Colleen Horton, Program Officer of the Hogg Foundation for Mental Health. Ms. Horton is an expert in state and federal disability policies, and since 2001, she has worked at the Texas Center for Disability Studies at the University of Texas at Austin. As Public Policy Director and a Children's Policy Specialist, she gained extensive knowledge and experience in legislative and administrative rulemaking processes. Before that, she was an advocacy coordinator for Texas Advocates Supporting Kids with Disabilities. Ms. Horton is chair of the Children's Policy Council and a member of the Promoting Independence Advisory Committee and the Task Force for Children with Special Needs at the Texas Health and Human Services Commission. She also serves on the Money Follows the Person Demonstration Advisory Committee at the Texas Department of Aging and Disability Services. She has a master's degree in public affairs and a bachelor's degree in business administration from the university. Before we begin the presentation, please note that questions can be typed into your control panel throughout the presentation, and time permitting, they will be addressed at the end of the presentation. Welcome, Colleen.
Good afternoon, everyone. I hope you can hear me. We're switching headsets right now. But I'm happy to be with everyone today. I'm hoping that the information that I offer you is helpful. It's a lot of information to give you in an hour. So I wanted to give you my email address to start off with so that if you have questions or even would just like a copy of the presentation, I can email it to you. So it's colleen.horton, as you see on the cover page there, at austin.utexas.edu. So please contact me if you have questions or if you would like a copy of the PowerPoint. So here's what we want to cover today, a little bit about Medicaid and CHIP, managed care and community safety net services, Medicaid waiver programs, STAR Plus, and if we have time, consumer-directed services. I will be going through it quickly because I want to make sure we have time to discuss some of the changes that are ahead as a result of the most recent legislative session. The information I'm giving you today is how things are today, but there will be some changes, not necessarily immediately, but in the years to come there will be some significant changes to the long-term services and support system. So I want to make sure that you're aware of what is coming. So Medicaid, it's an entitlement program. It was established in Texas in 1967, and it was intended to provide health care to low-income individuals. It's part of the Federal Social Security Act. So it covers low-income families and children, pregnant women, folks who are elderly who have low income, and people with disabilities. One population in Texas that is not covered in Medicaid is the folks with very low incomes who are childless adults. This is the population that the Medicaid expansion you may have heard of under the Affordable Care Act would have provided Medicaid coverage, health care coverage to. But in Texas, it was determined by the governor and the state legislature that we would not be expanding Medicaid. So this population of adults primarily will still not be eligible for Medicaid. Many of in this population are adults who have serious mental illness. Medicaid is an entitlement. It's which means that once the eligibility criteria is set up, that anyone who meets that eligibility criteria is eligible. The state cannot create a waiting list and make people wait. So the state cannot limit the number of people who are in Medicaid due to financial resources or state appropriations. I put this chart up there, where does Texas spend its Medicaid dollars, just to point out that the population of people with disabilities in the Texas Medicaid program is approximately 30% of the total, yet the costs are close to 60%. So that's important because whenever the state is looking at cost containment measures or how to control costs in Medicaid, obviously the folks with disabilities are going to be part of the discussion. Now that doesn't mean that the costs associated with this population are all about the long-term supports and services. This population also has significant acute physical health care needs, so oftentimes some of the focus is on how to reduce the medical care costs, and at times that means by improving the community services. But it is something that's important to know that this population does incur more than half of the cost of Medicaid in our state. Mandatory services, you see the list there. I'm not going to read it all to you, but mandatory services are what the federal government requires states to cover. Medicaid is a state and federally funded program. Since the feds put in a good portion of the money, they have certain requirements, and one of the requirements is that these services be covered. Optional services are services that the feds are willing to contribute to the reimbursement, but it's not mandatory that the state include these in their state plan. So if they so choose, the feds help pay for it. If not, then it's just a service that folks don't get. And you may be surprised by some of the services that are optional. For instance, prescription drugs are not a mandatory service, but luckily in our state we do cover a number of the optional services. Children in Medicaid are afforded a little bit more coverage than adults. Because of some lawsuits in the past, all medically necessary services for kids are required to be covered. In Texas, this is done through what we call the Comprehensive Care Program. One of the things that is in the children's Medicaid program, not in the adults, is what we call personal care services. This was added a number of years ago, but it's basic attendant care to help the family support the child in the home to avoid institutionalization, which we'll talk a little bit more about. But this can provide just general care, help with bathing and feeding, and just daily activities of daily living to ensure that the family has the help that they need. It's also available not just for children who have medical needs, but for kids who have emotional and behavioral needs as well, and cognitive needs. Right now, children are voluntary in managed care. We'll talk about the managed care programs a little bit more later, but it is anticipated that that will be changing. But historically, since the beginning of managed care, long-term services, and supports, children have been voluntary in this system. So for a lot of these programs, I'm going to have in here instructions on how to apply for the services. I'm not going to go through the details of each one, but just to make you aware, for Medicaid, you can apply by phone, you can apply online at yourtexasbenefits.com, or you can provide at a local Health and Human Service office in your area, in your community. If you're involved with the Texas Medicaid program, you may frequently hear of TMHP, which is the Texas Medicaid and Healthcare Partnership. This is the organization that the state contracts with to provide the administration of the program, including reimbursement of claims to providers, prior authorization, and those kind of things. So they often have a significant influence in access to services and what services are provided. If you want more information on Texas Medicaid and CHIP, there is a document that the state puts out, and I can't remember if they put it out every year or every other year. So the most recent copy may be 2012, but it provides a lot of very reader-friendly, understandable information on the program, and it is available online. The Children's Health Insurance Program, what we know as CHIP, is available to families who still have low income, but they're above the Medicaid level. And it's available to children under 19 years of age, 12 months of eligibility when you sign up for coverage, and there are cost sharing and co-pays in CHIP. These are the last ones I was aware of. They're pretty low. There may have been some adjustments as a result of the recent legislative session, but I'm not sure, and if they were, I'm sure they weren't very much. So this is a pretty good idea of what they would be. In Texas, we also, for individuals with disabilities, both physical, cognitive, developmental, and mental health disabilities, there are services in the community at what we call the local community centers. They used to be called the MHMR centers. Now they are called the local centers in most places. Some places still call them MHMR. These centers have basically two branches. One is the local authority that provides services to children and adults with developmental disabilities. The other side of the community center provides services to children and adults with mental health conditions. As you can see, some of the services that are provided are service coordination, respite, employment services, flexible services. And at the local authority for the developmental disability services, these are funded almost exclusively by general revenue or state dollars. And in some areas, the local authorities also get grants or funding from the local community, but a lot of that is state general revenue funds. On the local mental health authority side, they provide children's mental health services, adults mental health services, crisis services, and emergency psychiatric services in the state psychiatric hospitals. One of the big changes from this most recent legislative session that started this past January and I think finally ended yesterday, but was Senate Bill 58, which is going to move the mental health services provided to children and adults who are Medicaid eligible that are currently being provided at the local mental health authority or through the local mental health authority. Those services are going to be moved into managed care and integrated with the managed care organizations that currently provide acute and physical health care. A lot of folks are interested, especially if kids with disabilities are interested in the Medicaid 1915C waivers, or often referred to as community waivers. Again, they are state and federally funded. They provide community long-term services and supports, and I'll show you for each of the waivers what services are provided so you can get a pretty good idea of how they can be used. To have a waiver in a state, you must submit an application to the Center for Medicare and Medicaid and Medicare Services, and they have to approve it, again, because they are providing a significant portion of the funding, so they have a lot of say in what must be included and how it must be designed. Waivers were created to provide alternatives to institutionalization. They waive certain Medicaid rules so that states can provide programs to prevent people from going into state-supported living centers, nursing homes, or intermediate care facilities for people with developmental disabilities. And so when they say that the waivers waive off an institutional setting, that means certain waivers, the eligibility for certain waivers is contingent on whether you would be eligible for a particular type of facility. So if a waiver waives off of a nursing home, that means to be eligible for that waiver, you would need to meet nursing home eligibility requirements. The same thing for a waiver that waives off of intermediate care facilities or state-supported living centers. As an editorial comment, I believe that Texas has too many waivers. We have 8 different 1915C waivers with different administrative units, different rules, different service arrays, different reimbursement rates, different regulations and monitoring requirements, different billing guidelines. It makes it very, very confusing for families. It makes it confusing even at the different agencies, because often people who work in one program don't know the services or what's available in another program, so it's hard for them to assist families. Some of this will change as a result of some of the legislation I'll be talking about a little bit later, but right now this is what we have. So I'm going to be going through the different waivers that we currently have. Again, I'll be going through them pretty quickly, and if you have additional questions, obviously get in contact with me later. One thing that all the waivers have in common is that waiver programs must be cost neutral in the aggregate. That means the federal government requires that for the population in a particular waiver program, it cannot cost more to provide that population services in the community than it would to provide that population services in the institutional setting that it waives off of. So that means some people in a waiver will be higher than the institutional cost of care, some will be lower, but in the aggregate it has to be cost neutral, so it has to be no more than what it costs in the institutional setting. Just a few more editorial comments. You know, we have over 100,000 people on the various waiting lists. It's a lot of people waiting for services, and each legislative session money is appropriated for new waiver slots, but it doesn't even put a small dent in the total waiting list. So just some things I like to remind folks of. You know, waiver services, if you're lucky enough to get a waiver slot and receive waiver services, I think it's important to remember that it's not an all-you-can-eat menu. That, you know, I believe that every child should be able to access the services that they really need and that their families need to support them in the home. But if you're fortunate enough to receive waiver services, I think we also have a responsibility to not use more than what is needed. It's really not a contest of whoever gets the most services wins, and it's not a matter of if you use more services, you'll be able to keep your waiver slot longer. That's not how it works. And with tens of thousands of folks waiting for services, you know, every dollar that someone uses affects how long other children and adults will have to wait on the waiting list. So, you know, I think it's just good to keep in mind that, you know, we use what we need and get our kids the services they need, and then we keep in mind other folks who are waiting. And as I'm sure some of you know, the wait for some of these waiver programs is over 10 years. So I think it's important to be cognizant of the fact that resources are limited. The first waiver program that I wanted to talk to you about is called the Class Waiver Program. It's Community Living Assistance, Supports, and Services. And this program provides home and community-based services to people with what we refer to as related conditions as a cost-effective alternative to placement in an intermediate care facility. Related conditions are developmental disabilities, but they call it related conditions because this waiver is for folks with developmental disabilities who do not have a primary diagnosis of intellectual disabilities. The reason that is because this waiver came in after the waiver that is primarily for people with intellectual disabilities, and it was to fill the gap that the initial waiver, what we refer to as HCS, I'll talk about that in a minute, did not cover. So it doesn't mean that people with a diagnosis of intellectual disabilities is not eligible for this. They are, but there's usually another disability like autism, cerebral palsy, seizure disorder, something else that qualifies as a related condition. To be eligible, you have to meet the level of care for an intermediate care facility. You must have a need for habilitation. Habilitation is, you know, someone to train you on activities of daily living and instrumental activities of daily living. The assessment for eligibility is conducted by direct service agencies, nursing staff. And to be eligible for this, you must be diagnosed by the age of 21 years. The financial eligibility for most of the waivers is very similar. You have to be under 300% of the federal poverty level. But the unique thing for children and families is that it's based on the child's income, not the family's income, unlike Social Security that looks at the household income. Waivers look at the child's income, and of course most of our kids don't have income, so most of our kids would be eligible. Eligibility is determined by the Health and Human Service Commission. And when it says service plans may not exceed 200% of the cost of care in an ICF, that goes back to what I talk about, how things have to be cost neutral in the aggregate. So they put a cap on it, which is generally 200% over the cost it would be to serve that person in the facility. But then that means other people, significant number of other people have to be under that to make sure that it's cost neutral. There are exceptions that can be made to the 200% cost cap, but that's the general rule that they try and follow. The services available in class, here's the list. Adaptive aids, case management, habilitation, on and on. One of the things that is specific to this waiver that's not available in other waivers is specialized therapies, which includes things like recreational therapy, hippotherapy, music therapy, and some others. And this is often important to families of kids who have autism because these kids really need some of this sensory therapy. And so that's why a lot of folks are anxious to get the services, especially when they have children. I put employment services and supported employment on here in italics because it is currently not available, but legislation did pass that requires the state to add employment and supported employment services to all the 1915C waivers. So I believe it's as of September 1st that will be a service that's available. How to apply for services, there's a toll-free number. One thing that's common across all the waiver programs is that when you call to put your name or your child's name on the waiting list, you have to have certain information available, Social Security number, if your child has a Medicaid number, to have that, the type of disability, the age of onset of the disability, the child's date of birth, address, phone number, all those kind of things. So just so you know what to have ready when you do make those calls. It's important that you can, once you put your child's name on a waiting list, that you confirm annually. Things do happen where people's names have dropped off the waiting list, so keep all written correspondence and documentation that you might have of when you put your child's name on the waiting list, because if it happens to drop off at some point in time, it can be put back on as of the initial date if you have some documentation. So keep the documentation and call annually to make sure that you're still on the list. Assessments for eligibility for the waiver are not done until the services are offered. It would be very expensive to do assessments on 100,000 people or plus who are on the waiting list. And the reality is that the wait is so long that oftentimes the assessment would not be valid by the time the person's name comes up on the waiting list or when they become eligible for services. So it doesn't, to get your child's name on a waiting list, there is no assessment. There's a few screening questions, and that's about it. The next waiver, this is the Home and Community-Based Services waiver. It is for persons with intellectual disabilities who may be living in their families, in their own homes, or in other community settings such as group homes. This is the waiver that was created specifically for people with intellectual disabilities. Eligibility requires that you have an IQ of 70 or below, unless you have a related condition, another developmental disability, with an IQ of, then you can have an IQ of 75 or less. So if you have a child with autism who has an IQ of 75, you're still eligible for the HCS waiver. The assessments, when you come into services on this program, the assessment for services is done by the local authority staff that we talked about earlier in the program. And as you can see, the financial eligibility is very similar to the class. I'm getting a noise in my headphone. I hope you all don't hear it. It sounds like running water, but hopefully you can still hear okay. Here are the services available in the Home and Community-Based Services Waiver. The thing that's unique about this program is that it provides residential services. It provides supervised home living, supports in the home. It provides foster companion care, and it provides group home care. And none of the other waiver programs offer this type of residential support. Here again are the directions. Excuse me, we have to pause for just a second.
Welcome to Webinars Made Easy.
Okay, sorry about that. We had some technical difficulties. Here are the instructions on how to apply for the waiver. It's very similar, so I'm not going to go through those again, but if you have questions, feel free to call. Medically Dependent Children's Program provides services and supports to families who have children and young adults who are medically dependent. And again, this is to keep these kids out of nursing homes. Very similar or the same financial eligibility limits, the disability, or not limits, but eligibility criteria. The disability criteria is you have to meet eligibility for nursing home. You have to be under the age of 21. There's only a couple waivers that are based on or have age limitations, and this is one of them. These are the services. It's much more limited. The real benefit of being on the Medically Dependent Children's Program is that you do have access to Medicaid. All of the waiver services, once you are in a waiver program, you have access to the full array of Medicaid services, not just the long-term services and supports. So the real benefit for these kids, they have a lot of physical disabilities, medical disabilities, and it provides them access to the comprehensive medical services provided in the state Medicare program, or Medicaid program. And in addition to that, they provide respite, adjunct support services, adaptive aids, minor home modifications, that kind of thing. Again, how to apply, and stressing the need to confirm annually that you're still on the list. The Deaf-Blind Multiple Disabilities Waiver provides home and community-based services to people who have multiple disabilities, again, as a cost-effective alternative to institutions. The program focuses on increasing opportunities for consumers to communicate and interact with their environment. When you have multiple disabilities, that's obviously a huge challenge. The requirement that's unique to this is you have to have deaf blindness and a third disability, which results in a need for some pretty intensive services. The services are a little bit different because you have things that, such as intervener services, orientation and mobility, things that people who have blindness or who are deaf specifically need that other waivers don't really need. Employment services will also be added to this waiver. And there's the number. The community-based alternatives waiver program provides services, basic community services to people who are elderly and adults with disabilities. And again, this waiver waives off of nursing homes, so to be eligible, you must be eligible for nursing facility care. This is the other waiver that has age limitations. For this one, you have to be over 21. So what typically happens is if a child is in the Medically Dependent Children's Program up to the age of 21, they automatically move to the Community-Based Alternatives Program at 21. The unique, different thing about the CBA program is that most of people on the CBA waiting list were moved into the STAR Plus Managed Care program a number of years ago. and we'll talk about that when we talk about managed care. So the community-based alternatives program are for people with physical disabilities who are between 100% of the SSI Social Security income level and 300%, because those under 100% are in the managed care STAR Plus program. And I hope I can make more sense out of that for you in just a minute. Here are the services. They're pretty basic. The CBA program, when I talked earlier about how there's different rules, regulations, reimbursement rates, and cost caps for the different waivers, the CBA program has historically had the lowest cost cap, and so there's fewer dollars for folks to spend in this waiver to get their community services. Here's instructions on how to apply. For those who don't know, 211 is an information network that is available across the state of Texas that you can call, and hopefully they will direct you to services and resources in your area, in your communities, and they should have all the information you need on how to apply for various services. The YES waiver, the Youth Empowerment Services waiver, it allows more flexibility in funding for intensive community-based services and supports for children with serious emotional disturbance and helps to support their families. The YES waiver is the only 1915C community-based waiver that we currently have for those with mental health challenges or those living with mental illness. And the YES waiver is still in what they call a pilot phase. It achieves cost neutrality or waives off of state psychiatric hospitals. It is currently only available in 3 locations in Texas: Bexar County, Travis County, and Tarrant County. However, there was a legislative directive to expand this waiver statewide. It was in the appropriations bill, and the funding was provided for the expansion. It is anticipated that the next expansion area will be Harris County. Now, although the directive is to expand statewide, it's probably not realistic to think it will go statewide in the next 2 years, but the state will have to move in that direction and will have to produce a plan for how they expect to expand the services across the state. It provides intensive mental behavioral health services in the community, and again, like the other waivers, it's intended to prevent hospitalization or placement in a residential treatment facility. This one, unlike the other waivers are primarily administered by the Department of Aging and Disability Services. This one is administered by the Department of State Health Services because that is the department that oversees mental health services in our state. Eligibility, the child has to be, or adolescent has to be between 3 and 18 years of age. As I said, it's limited to 3 counties right now. A difference from the other waivers is that they must not be residing in an institutional setting to get the waiver, which is unusual because in our other waiver programs, people who are currently in institutional settings often have priority access to waivers to get them out. This one says you have to be in the community already to access the waiver program. So it's not available, say, to kids who are in state hospitals or who are in residential treatment centers. This is something that we are going to try and change during the process of the expansion. The Department of State Health Services develops the clinical criteria, but basically it's for kids who are very much at risk of being hospitalized. And there has to be the reasonable expectation that without the waiver services, the child or adolescent would qualify for inpatient care. I'm getting a message that the audio connection has been lost. I'm hoping that you can hear me. Okay. I have a message now that it's been restored, so I don't know. Here's some of the services that are available in the YES waiver. Again, employment services and supportive employment services will be added, and the other are traditional intensive mental health services. Here's some information on how to apply in the 3 counties that where the waiver currently exists. And as I said, in 2014, I believe, in the spring, they plan to expand to Harris County. The Texas Home Living Waiver is what we refer to as Waiver Light, simply because the cost cap is much lower. It's around $17,000. This program provides selected essential benefits to support folks with intellectual disabilities who live in the community. There's no age limit. You have to meet the same disability eligibility criteria as with the HCS waiver, except you cannot have the level of need 9, which is a very high intensive level of need, because they assume that this level of service would not be sufficient to keep you safe, and you have to live in your own home or your family home. There are some differences with this on how it's administered. This waiver does not have a separate waiting list. It works off of the HCS waiting list. And so when they have slots available in this waiver program, they simply go down the HCS waiting list and contact people there. When you accept the Texas Home Living waiver, your name remains on the Home and Community-Based Services waiver waiting list, because it's a much more comprehensive array of services. So I've had questions from some folks, if I accept the Texas Home Living, does that take me off the HCS? And it does not. The other unique thing about this waiver is that this is the only waiver where they do consider the family income or the parent's income. So unless the child or adult is currently eligible for Medicaid, meet financial eligibility for Medicaid, they would not be eligible for this waiver. And here are the services. They are very similar, although not quite as comprehensive as what is available in the HCS waiver. Let's see, I think I've covered most of this. Yes. This waiver allows all services to be consumer directed, and we'll talk about that, but all of the waivers have some options for consumer direction, meaning you can be the employer of record of the providers of some services, but this is the only waiver that allows all the services in the program to be consumer directed. Managed care. Managed care is a big deal because that's the direction the state has been moving for a number of years for most of the publicly funded services, and they continued that push this most recent legislative session. There are several different managed care programs in Texas. STAR is the managed care program that provides the basic acute physical care for people in Medicaid, mostly, children or adults with children in the Medicaid program. STAR Plus is the Medicaid or the managed care program I spoke about earlier that provides medical care, physical care, and long-term services and supports. It's very similar to the Community-Based Alternatives Waiver Program. North Star provides behavioral health, which is mental health services and substance abuse services. And it's what we call a carve-out, in that it is a managed care program providing the services, but they are not part or integrated with the managed care services for acute and physical care. They are separate. So if someone is eligible for North Star Behavioral Health Services, then they get their mental health services from North Star, but then they have to go to a different managed care company to get their physical health care. The Star Health program is for children in the foster care system across the state, and that was created just a couple sessions ago. So as I said, Star Plus is a managed care model. It requires waiver from the federal government. It provides all the same services that were available in the Community-Based Alternatives Program, with the option of the managed care company offering more. And the provider rates in all the managed care programs are negotiated with the managed care organization and not with the state. Star Plus is an entitlement, so those who are eligible do not have to wait on a waiting list. Some of the things I wanted to talk to you about as far as changes that are coming in the future come from Senate Bill 7, sponsored by Senator Nelson, the chair of the Health and Human Service Committee. And basically it was a redesign of the long-term services and support system. It requires the state to develop a plan for reforming how we provide long-term services and supports, especially to folks in the intellectual disability system. I've put on this slide some of the major changes. The bill was between 45 and 50 pages, so there's a lot more to the bill than this. But these are some of the things that I think folks have probably heard some about, but maybe not. They're going to create another managed care program called STAR Kids, and this will be for all kids with disabilities. As I mentioned earlier, if you remember, that kids have been voluntary in managed care, that they have had the option to remain in fee-for-service programs. But when this is developed, it will require that all kids with disabilities in the system receive their acute care, physical care services through STAR Kids. One of the changes is that Texas Home Living Waiver Services, the one I just talked about a few minutes ago, will move to managed care. So a managed care company will be contracting with various providers of the various services, and then you will receive the services from those providers, but the rates and the management of the program will be through the managed care company, through the STAR Plus organizations. There will also be created managed care pilots for intellectual and developmental disability services. The legislation allowed for a couple of pilots, and the commission, the Health and Human Service Commission, has some flexibility in who those go to and how they are designed, but the idea is to see how well managed care can work for services for people with intellectual and developmental disabilities. Nursing facilities are also being carved into managed care. They have been separate and they have been contracting directly with the state, but now they will have to also contract with the managed care companies to provide those services. The benefit to the state of having all these services through managed care is that it provides some limits on how much the state will have to pay, or at least gives them a better idea of what they will have to pay, because it is what is called a capitated model, which means the state pays a certain amount every month for every member that's enrolled with a managed care company. And the managed care organization has to provide all the services needed. So it's really the managed care organization that it is at financial risk and not the state. Now, this could be fine if it's designed well, but obviously managed care organizations are there to make a profit. So the real concern oftentimes is, does this mean a reduction in services? The state has made it clear that this is not intended to mean a reduction of services, but again, the devil is always in the detail, and it'll be important for individuals, families, advocates, everyone to watch how these are designed and implemented. The plan is to move most intellectual developmental disabilities services to managed care over the years. Now this plan goes on until at least 2020. So it's a very phased in process. And again, it seems I'm losing folks. Okay, I hope we're back. So as I was saying, the plan is to look at this over the course of the next, 6 to 8 years. But the idea is that if it is cost feasible, if it makes sense, that the Health and Human Service Commission will move IDD services to managed care. One of the big benefits of Senate Bill 7 is that it creates what we call a cost-effective attendant and habilitation services program in the Medicaid state plan. This is an option that was available under the Affordable Care Act. It's called the Community First Choice. And what this means is that at least 12,000 people who are currently on the waiting list will be automatically eligible for community attendant and personal care and habilitation services when the program goes into effect, which I believe is expected to be in 2014. So that means, 12,000 people can get some basic attendant care without waiting anywhere from 3 to 10 years on a waiting list. And it will be available to people with all types of disabilities, including those with intellectual disabilities. So that could really be a boost to a lot of people who are currently waiting for services. Because of the reform in Senate Bill 7 and the massiveness of it, the legislation required the Commission to create a number of advisory committees. The agency is currently accepting applications for those various advisory committees. They're looking for consumers and for families and providers and a number of different stakeholders. So if you're interested in being part of the discussion on how these programs are designed and implemented, I encourage you to go to the website and consider applying to be on one of these advisory committees. The deadline is coming up. It's August 14th, so if you're interested, you probably need to do it fairly quickly. Okay. These are some other services that are available outside Medicaid and the Medicaid program. And consumer-directed services, as I mentioned earlier, I'm not going to spend a lot of time on this because I want to have some time for questions. But basically, this is a program that allows the consumer or the consumer's family or legally authorized representative to take more control over who provides those services and allows the individual or family member to become the employer of record, which means you can hire your own attendants, you can supervise, you can train, and you can fire if needed your own attendants. And you don't have to just accept what a provider agency or who a provider agency sends into your home. So it gives the consumer, it's one option for really developing more self-determination in your service provision. And here are the 3 different types. I'm not going to go into them, but if you need more information, there's a lot of information on the Department of Aging and Disability website on consumer-directed services, including some videos that you can watch that explain the different models. Here are some of the services. As I said before, typically not all the services in each of the waivers can be consumer-directed, but one of the initiatives of the Consumer Direction Work Group is to hopefully keep increasing the services that can be consumer directed and the number of programs that use consumer direction. Looking forward, we do have the Medicaid reform, expansion of Medicaid. We've had change in leadership at the Health and Human Service Commission. And we're also going to have likely some significant changes at the legislature. The governor's not running for re-election. There's, at least now a 4-way race in the Republican Party for the lieutenant governor. There's going to be, a lot of changes at the legislature. So it's going to be important for advocates and families to stay connected to their legislators and let them know what types of services and how important, what types of services are needed and how important these are to kids and adults with disabilities. Here's some resources, and that's about all I had. And I know I talked very quickly, so I'm going to go to see if there's any questions on here, if you'll just give me a second. Okay, someone asked, how much is the SSI income limit? I don't have the chart with me, But if you just Google SSI income limit, you can get a whole bunch of information, or go to the Social Security Administration website. You can find it on there. Next question, can you define intermediate care facility in regards to the class? Is this the same as an institution? Yes, these are intermediate care facilities are institutions that can be privately run or state operated. The state operated ICFs are the state supported living centers. The privately operated intermediate care facilities are institutions. They range anywhere from 6 beds to 300 beds, although there has been success in closing most of the large intermediate care facilities. But they're an institution, most definitely, and they are an entitlement. So if you are a person with developmental disability who meets the criteria, then you are entitled to that institutional placement without waiting on a waiting list. And that's what these waiver programs are designed to avoid, is people having to go into these institutions to get the services they need. The next question, if one is already receiving benefits through class, what would be the benefit of accepting the HCS waiver? That's always a huge question. It just depends on the individual, because although a lot of the services are similar, there are some big differences in the services. For instance, if you have a young child who has autism and can really benefit from some of the specialized therapies, such as hippotherapy or recreational therapy, you might want to choose, if you have a choice between the two, you might want to choose between the class waiver so you can get those services. The HCS waiver, however, has some long-term benefits in that it provides some residential services that an individual may need as an adult, you know, the group home or the foster companion care. So it's really a very individualized decision. There are some spreadsheets, charts on the DADS website that outline the differences so that you can look at the program side by side to decide which one would provide the services that you need the most. If we don't qualify for some due to family income, when my son turns 18, will he have to apply and start at the bottom of the list? No. If you're talking about the waiver services, the only program that he would likely not be eligible for because of family income is the Texas Home Living, and that doesn't even have a separate waiting list. All the other waivers are based on the child's income. But regardless of that, if a child's name is put on the waiting list at 14 and they don't get offered a slot until they're 20, they keep their same place on the waiting list. There should not be any change in that. But again, it goes back to making sure that you check on it annually and that you keep any documentation. I recently got a call from someone who said they called their local authority to find out where they were on the waiting list, on the Home and Community-Based Services waiting list, and they were told they were no longer able to tell the family or the individual. So I called the state office and asked about that, and they have not been told that they can't tell. What they have been told is to caution folks, because for the HCS waiting list, there are basically two waiting lists. The local authorities keep a waiting list for the people in their region. And there's also the state waiting list, which is a compilation of all the regions' waiting lists. And it's all, the state waiting list is done, as is the local one, by the date that you first applied to have your name or your child's name put on the waiver waiting list. The problem has been that somebody will call the local authority and they'll say, well, you're number 125 on the waiting list. Well, that's the local list, but the names come off the waiting list when slots are available from the state list. And while you may be 125 on your local, you may be, 1,025 on the state. So just make sure you understand if you call and ask that question and you're given a number, that you understand, is that the local regional list or is that the state list? And the last question I have is, if a child is receiving MDCP services, does he also have to be on CBA interest list in order to automatically move to the CBA after 21 years of age? The answer is no. They do not. They have a bridge from MDCP to CBA. And a lot of that now is from MDCP to the STAR Plus program. And that will probably increase because the CBA program will likely continue to reduce in size as more and more people are moved into managed care. So I have that we're 2 minutes from ending, and I don't have any more questions. So I hope some of this was helpful. I know I talked fast and gave you a lot of information, but hopefully it will at least steer you, give you some direction on where to go. I would urge folks to, if you don't have your child's name or your name on the waiting list, to do it and to